responsible for control, eradication, and something else of prevention of disease. He worked with poultry, equine, and ticks primarily. With that, I'll turn it over to Dr. Michael Greenlee.
Thank you. One of the things working for the USDA, a lot of people, you get calls, oh, well, you inspect meat. Well, no, we don't. At the USDA, there is an agency that does, but I'm with the Animal Plant Health Inspection Service, of which there are about 4 real divisions. The one I'm in is veterinary services. There's also the plant protection and quarantine that deals with plant pests. There's a division called animal care that deals with animal welfare issues, pet stores, exhibitions, things like that. So, I mean, we're pretty broad in what we do. But anyway, ours is focused on veterinary issues for the most part. If you have a dog or a pet you're taking out of the country and you've got to get a health certificate endorsed, that comes to our office. We have kind of a separate little division that takes care of that. And I'm what they call the area epidemiology officer. So I'm an epidemiologist, veterinary epidemiologist by trade, and but because Texas is such a large state, where I've been before, pretty much dealt with all diseases. We had to kind of divide things up here. So equine diseases is a big one, and that's actually been taking the majority of my time recently due to an outbreak of a blood-borne parasite in horses. It started down in South Texas, transmitted mainly by ticks, and so that's been taking up a lot of our time. But poultry diseases is something that fortunately we haven't had much to do with in the last 2 years here. We haven't had any outbreaks that we've had to deal with, at least diseases that we're concerned about. So, and if we do get one, it's not, I guess the way to put it is, once you've got the disease, the choices are pretty limited and they're not very nice. Either you've got sick birds that aren't doing well and they're dying, or they may have to be destroyed. It might be the only way to get rid of it. So really, the focus should be on prevention. And that's mainly what I'm here to talk about. And probably with all you people in an organization like this, I'm probably speaking to the choir a little bit. The people that we really should be talking about are the ones that aren't here. But still, we've got a message to give, and hopefully there'll be a kernel or two that you can take home and maybe decrease the risk that your backyard flock is going to be one of these that's involved in something like this. Okay, biosecurity, it's kind of a big term, but basically it's just the steps that you can take to reduce the risk that your birds are going to be exposed to something that you don't want them exposed to. And list up here, bacteria, viruses, parasites, and then this is a presentation that came down from our headquarters. You have to have approved presentations to take them to an outside group, and there wasn't time for me to put something on it. First when I saw that, I thought, well, what are they talking about? Those other things are all diseases. But I guess then there are other things like, toxic agents. We see poisoning from algae or from insecticides, other things, and all still could be considered diseases too. But viruses are probably the thing that the USDA is most concerned about, and 2 in particular: avian influenza, which has been in the news quite a bit, and Newcastle disease, another one. And there'll be more on that later. But those are probably things that, because they're considered foreign animal diseases, we're really concerned about. Bacteria, there's a bunch of them. There's fowl cholera. There's some that are transmissible to humans as well. Parasites, certainly, probably, you're probably familiar with external parasites like lice and mites, but then there's also internal parasites that can really rob your poultry of their ability to produce, whether you've got egg layers or whether you're raising them for meat or whether you just want healthy birds as pets. Okay, here's the 2 I mentioned. And exotic, we had. Newcastle disease, the exotic kind, is the one that causes a lot of fatalities, high number of birds infected, and that's the one that's foreign. there are some other forms that are less virulent, and those do circulate in this country and don't seem to cause much of a problem. Avian influenza, on the other hand, we do have low-path avian influenza, especially in wild birds, migratory birds. If we test ducks enough, we're going to find it. But fortunately, it doesn't seem to cause disease. The concern is that if it passes through enough birds, and maybe even from ducks and chickens and enough birds, somewhere down the line, it will change and all of a sudden become more virulent. And influenza viruses in general are known for that. That's why every year we go to the doctor and we get a different vaccine than the one we had the last year because it's constantly changing. Okay, warning signs, and these are things that I'm sure probably really don't have to tell you, because if you see these signs, they're so dramatic compared to healthy birds that you know something's wrong. And of course, increase in deaths. What can you say? One, if you've got 3 chickens, that's pretty significant right there. But if it's an older bird, you might not think too much of it. But if you got one, and then 2 days later, here's another one, well, something wrong is going on. You definitely know it. The respiratory signs, sneezing, gasping for air, coughing, and nasal discharge can be caused by a lot of things, but it's certainly something you want to be concerned about. The avian influenza and Newcastle disease are just one of the things that can cause that. But they're not signs that you would see in normal, healthy birds. Watery and green diarrhea. Again, by itself, any one of these, other than maybe the respiratory diseases, don't cause you too much concern. But when you see one or more, then you really know that something's going on. Lack of energy and poor appetite, that's pretty much nondescript. By itself doesn't mean too much. But you saw another one. And the bottom of them, we get called quite a bit. They quit producing eggs, or they're misshapen or have soft shells. Again, lots of things can cause that. But if you saw that coupled with the watery and green diarrhea and maybe some deaths, all of a sudden, boy, those together indicate you've got a real problem. So here's, now you can't see these pictures very good. Maybe we can just for a minute turn the lights off, just because maybe it'll be more dramatic. Okay, now the upper one there, the swelling around the head, you maybe can't see it real good, but up here around the eyes and right in here, this is all real swollen. I've actually seen birds like that when I went to Plum Island, and it's very dramatic when you see the healthy ones versus that. And this here, this purple discoloration of the walls in the head, that means they're not getting enough oxygen due to the respiratory disease. And boy, if there's any one thing that says avian influenza, and there probably isn't, but if there was any one thing, that would be it. That's very dramatic and it's such a change. On the other hand, what we're seeing in this bottom picture is a neurologic disease, and can be caused by several things. But if you're seeing it in quite a few birds, that indicates it's infectious and it's happening rapid, and it's the likelihood of it being exotic Newcastle disease is great. They're tremoring, and they have difficulty walking, and their heads twisted around funny. You think maybe their neck had been injured or something, and it's again really dramatic. So when you see either of these type of sets of signs, you know something's wrong, and you want to call somebody right away. Not just for you, because it might be too late, unfortunately, to do much with your flock, but your neighbors and your acquaintances and everything. If we can stop it where it's at, we can reduce the total effects of it. So, and here's really what I'm here to talk about today: 6 ways to keep your birds safe. And if you look, these things are really, I guess we would put them up as the ideal, because we realize there are trade-offs, but what we want to do is try to keep the risk as low as we can. I know one of the things that you guys have on your thing is taking tours, going to this person's place, this person's place, and if you were really trying to be possibly as secure as you could be, you wouldn't do that sort of thing. But there are some things that you can do, even doing that, to mitigate that risk, and we'll talk about it. Keeping your distance, keeping things clean, and I'll bet